everyone, and welcome to Nyaluk Foundation. My name is Cynthia and I am a director and coordinator at Nyaluk Foundation. Nyaluk Foundation was started way back in 2005, and our objective is to empower young people so that they can make better health decisions. But today we are at Mutukanio in Kihingo, Njoro sub-county, and our purpose today is to treat, come up with physical and mental solutions to medical problems that are affecting the members of this area. Today we're not particularly involved with young people per se. We are doing a medical aid that's running across all ages. We're grateful to God and we're grateful for the people of Kihingo. They've shown up in numbers, and what we're doing today is we are running a free general observation from our medical doctors. We have experts on ground. We also have dentists on ground, and we also have an eye unit on ground. What we'll do is we'll have our dentists and doctors and opticians check out our patients, and if any of them has a problem that cannot be solved today, together with our partners Skygen, who have come through for us today, and Esilor Foundation, who have also come through for us today, we will provide solutions by providing the dental units sooner or maybe this week. So the ones who will not get treated today will still get treated by Nyaluk Foundation. And so that being said, Nyaluk also does matters with sexual reproductive health, maternal care, mental issues, surgeries. It's basically a whole hospital dealing with every other issues. Thank you so much and welcome. Hi viewers, and welcome to another episode of Afya, Yetu. Today we are shooting live from Kihingo, AIC Mutukanio, and we're here because of a very important day to us as Nyaluk Foundation. My name is Cynthia and welcome to the show.
My name is Collins. I'm the CEO Nyaluk Foundation.
My name is Gracious Umondi. I'm a director at Nyaluk Foundation. I also double up as the board secretary and the legal advisor to the foundation.
My name is Emmanuel Kitoy. I work for Skygen International Foundation, and we are one of the partners with Nyaluk Foundation for the event today.
So thank you everyone for coming on board. And Nyaluk Foundation, like we've had before, is a foundation that is focused on sexual reproductive health amongst the young people. But that does not mean that's the only health issue we have. So we do talk to young people from the ages 18 to 35, the youth, and we also pay attention to maternal care, cancer, oncology generally. And today we are at AIC Mutukanio because one of our donors, Skygen has come on board to help us to run a medical aid. So we are running a medical aid to support the community in Mutukanio. And so what we're doing today is we are doing general health checks. We're doing mental health talks. We even have a legal aid on board who will talk to us as well. And we also have eye care. The eye care department will provide us with the things that my partners will talk about. So please, Collins, take us through.
Okay, thank you for giving me this chance. So apart from sexual and reproductive health, Nyaluk also deals with mental health, eye care, legal aid, and gender-based violence. So today we are in one of our facilities by the name Mutukanio Hospital, located in Kihingo. So the reason for this event, we thought it wise with our partner Skygen that we want to manage people, not only when they get sick, but we want to prevent. So as they say that prevention is better than cure. So this event is dubbed Care by Prevention.
Yes. Okay, Manuel, you want to talk about Skygen?
Sure. So Skygen is an organization based out of Milwaukee in the United States. Their main mission is to provide access to healthcare in remote areas or underserved areas such as Tanzania and Kenya. Skygen International Foundation has been working in Tanzania since 2018. And like Colin says, basically focusing on preventative health. Daily actions that people can take that over time become behaviors, and then also prevent medical things or challenges from happening to people. So that is kind of Skygen in a nutshell.
Okay.
That's what do you?
We shall also be providing free legal aid today. We will be in charge of that. Since Nyaluk Foundation mainly focuses on healthcare, previously we have had discussions in relation to the legal, the laws that have been laid down to try and guide healthcare in Kenya. We shall be specifically talking about that today, and apart from that, we shall be also managing individual people's legal needs. So if there is anyone who will be having legal questions, who has come for the medical camp, we will be here to serve you equally today.
Okay, thank you. So if you have any questions, you can catch us live on Facebook and YouTube at Tumaini TV. And our numbers for WhatsApp and SMS are 0711 0100 And you can also catch us live on Nyaluk Foundation, Facebook and Instagram. And you'll also get us on Skygen page. So to start us off, I would like Collins to explain to us what care by prevention means.
So care by prevention basically means that we don't need to get sick to come to us. We want to provide you with medical services, like is more of teaching you how to live a better life rather than waiting until you get the condition or you get the disease. So basically care by prevention is more of preventive measures, like maybe let's say maybe if maybe you are having maybe a dental caries. So we don't wait for you to get we don't wait for you to get a cavity. So we can teach you on oral hygiene so that you don't get those cavities. Maybe you risk maybe losing the eyes. You risk losing the eyes, so we'll tell you on what measures to take so that you don't lose that eye, because we are trying to prevent non-communicable diseases.
So care by preventive, does it mean we pay? Do the people pay, or what happens?
No, today we are just doing a free medical camp, free dental check, free eye screening, free lab, free pharmacy, like we are going to give free drugs. We are giving free drugs actually, and free medical consultation, be it MCH, maternal child health, and antenatal care. Yes.
Okay, and still on you, Collins, what would you say would happen after today's medical aid?
So after today's medical aid, we have a plan. Like we have a plan where these medical services, like initially we didn't have eye and dental units here, but we want people to continue getting these services. Like we liaise with our dentists and ophthalmologists, so that maybe the cases they cannot see here, they'll be booking and they'll be referring to our general hospital. And also we want to come up with a schedule where once per month, once per month, a dentist and ophthalmologist will be coming here to see those patients and will be providing the services to people who have those conditions. Yes.
And just to be clear, from today continuously, is it going to be free, or now you'll start charging?
You know, we are doing like a 2-day free medical care. Mm-hmm. Then after the 2 days, mm-hmm. people will be charged, because, you know, for management and running of the hospital is not cheap, but here we do at a very subsidized cost. Mm. Yeah.
Okay. So also, will insurance cover the dental and eye care?
We are in talk with the NHIF. Initially we had been accredited, but there were some cases with the bank registration and what have you. Then we were returned back to KMPDU. I think we are now in the final stages of getting NHIF. Before long, I think before our next event, we'll be having an NHIF here. accredited. Yeah.
Okay. Thank you. And Skygen, could you possibly explain your role into today's function?
Our role in this function was one to kind of be present. We try to be present wherever we're working, to kind of share space with the people and the community, and we believe that's a big way of building community. We are also here today because, as you can see, this is a remote area, and we're teaming up with Nyaluk to see if we can provide access to healthcare for the people in this community. So they can reduce transport times, transport costs to other hospitals. The more services that they can find here, the less than they have to go somewhere else. So we're trying to create access. We have been working in Tanzania and are now looking to expand into Kenya.
Thank you. And Dio, are there any policies that guide medical aids?
Yes, I would say yes, we have policies that guide medical aid. As you have seen, the government has really tried to subsidize, health costs in especially public facilities, public medical facilities. But we are a federal country and still it is not enough. I would say that is why we as Nyaluk are also coming in to come up with this free medical aid so that we are able to make health care affordable to the people. I would also go ahead to say that you see healthcare is expensive so far. Similarly to acquisition of legal services, they are also expensive. And you see what we are trying to do is to make it accessible to the people as much as we can by providing these free medical camps. So I would say there are policies in place, there are laws in place, but implementation is still ongoing. It has not been that much efficient. It has not been done to the best of the framework, the way it's supposed to be done. But it is progressive. We have a plan. We have the plan for 2030. So we are hoping that with time we are going to get to 100% implementation rate.
And still on policies, we basically just went on ground and asked people to come from this area. So if someone were to report us to the police, would there be a law that said we offered services that they didn't like or something like that, like a consent or something?
Like a consent. I believe we are authorized and we are holding a very much legal event right now. There should be no interference, I think, from the authorities because they have allowed us to do this.
Just to add on what Wakili have said, before, previously people could organize these events without permits from the government, but nowadays is a must that you have to seek guidance from the Ministry of Health in the local area, which we did, and you have to be given a permit to have a medical camp, and also they have to know the kind of services they are having. I think even they sent a representative here today, so we have to seek permit from the public Ministry of Health in that sub-location or in that ward. Also, the area chief must be aware that such like event is taking place. Yes.
And so now to still ask on the same. So someone has come here today and they've been seen by an optician or a dentist, and then their problem has not been solved to their expectations or to the best. So that kind of situation, Collins, what will you tell them to do?
Okay, here generally we are just offering the basic medical services, like the basic screening. We are giving the basic drugs and the basic glasses, readers and sunglasses. So if we get there's any case which we cannot handle here, normally we have referral notes. We refer them to the government hospital, which offers the services which we are offering here. So we have a good referral system, and the cases which we cannot manage here, they are being referred to Nakuru PGH. Yeah.
And still on referral now,
Yeah.
They get to pay the payment themselves at the referral station?
Yeah. You know, here we are doing it for free, but when they go to Nakuru PGH, Nakuru General, they have to pay. But I think with time, as Kaijen has said, that we want to work hand in hand so that we ensure that these services are available here at a very subsidized cost, so that, you know, when you are going to like Nakuru is quite a distance from here. It's like 1 hour drive, so it's far. So when you're going to Nakuru, you're wasting time, you're wasting money, and there are other issues you can sort out while. So we are increasing the access to health. That's basically what we are doing. Yeah. So this event is just creating awareness of the kind of services we want to introduce in this region. Like as for Nyaluk, we want to make this place a health hub where you can get all the services. Like I think maybe in 2-3 years, we want to make sure that this region has an ambulance where a mother who is pregnant and maybe she cannot deliver here has a means of transport to a general hospital where there's a consultant. We want to ensure in 2 years we have a pediatric ward here. Now we have male and female ward, but we want to introduce a pediatric ward here. And also we want to make sure in 2 years we have a theater where with surgeons and experts to do those surgeries here, so that people don't go to PGH to seek for those services. So that's our vision in this place. So I think we have a 5-year plan, and within those 5 years, we want to see this facility as a health hub of this region. Yes.
So Skyjan, are you willing to stick with Nyaluk for the next couple of years? Any comments so far working with Nyaluk?
We are very committed to the issue of increasing access to healthcare, also education, especially about the preventative measures. And so I think those are things we have in common. I don't see why not we would not work together so that we're not both pushing the same wheel. Yeah, it would be much easier to work together or collaborate on events, such events, hold them. But then also having a facility like this, so we could hold an event somewhere else, like at a church, and then you refer people here for the services that we might not be able to provide there. And so, you know, the more places, I guess in airports they call them like forward operating bases, or in the Army, where you know, like you kind of keep moving forward a little bit and you keep getting further and further, and that's how we keep increasing that access. But the other big thing that I think maybe you touched on, but maybe not, was the issue of sustainability. Coming in and doing a pre-medical clinic like this is great. I mean, it's awesome, but that can't be the end. These people, now that you've let them know, like, hey, you have cavities, or you need X, Y, Z, you also have to provide them with a place to get that. Otherwise, I mean, you're basically just teasing them, you know, like, you know that they can't go to Nakuru or maybe Nairobi to get this done. And so, that's the sustainability aspect is huge for us. Where in 3, 4, 5 years, it would be nice if this clinic was running itself and you guys were opening up another one somewhere else.
Towards building the future, Dio, what's your advice legally? Is it,
I would say, as Nyaluk Foundation, we have quite, as the CEO had indicated, we have quite an elaborate strategic plan, a 5-year elaborate and comprehensive strategic plan. We are committed to sticking it to the latter in order for us to be able to make this a sustainable project. Just as Emmanuel has indicated here, we have to look at sustainability. We have to look at being able to perhaps at the end of it fully sponsor healthcare. You see, for at the end of the day, for the majority of the people who are unable to afford and access healthcare. I believe we are working towards that. We have plans in place. Both medical-wise, we have a team of professionals we are working with, hands-on and also legally. So I believe we are on course, and we are committed, and we will get there.
Okay. And still on Collins. So we've established that today we're only doing eye care and dental care and general care. So I'd like to know what other services are being offered here in Mutukanio that are a sure bet for the people in this area.
So when we came in, the facility was a level 2 hospital. A level 2 hospital means that you are just offering the basic general services. But now we've registered this facility as a level 3A. A level 3A means that we have other general services, but we've included the wards and the maternal care, where we have maternity here, where people can come and deliver and go home safely with their babies, because we have professional nurses who works here 24 hours. So apart from eye and dental, we offer general medical consultation, we offer nutritional services, we offer maternal care, child care, we also offer laboratory services, and we have a pharmacy full with drugs. And we also have inpatient for male and female, and we are working on putting up a pediatric ward in the next, I think, 1-2 years. It should be in place. And we are giving drugs at a very subsidized cost. Yeah.
Oh yeah, and which reminds me, today we bumped into a psychiatric patient, and in such cases, would you offer solutions here? Do you have that kind of
that kind of plan? You know,
like a mental health or institution or something?
Yeah, we have a mental health department in our foundation, of which you are the head of it.
Yes.
And for such like an event, most mental, we do mental talks, mental awareness, like general mental talks, but in this event we are not giving mental health services, drugs per se, being that we did plan for it, and also the mental drugs are so expensive, and we didn't even get a specialist in the mental health department. But being that, like today I've seen 3, so I think it's something which I need to really work on in our next event, so that maybe we can have a few drugs for mental issues, and also I can talk to psychiatric. Maybe I can bring the psychiatric along for such like cases, because I know mental health issues are so stressful to the person, to the family, to the society, and the area at large, because you don't know what that guy is capable of doing just by being in that state. So it's a real crisis. Yes.
So viewers, we want to take a short break. We'll be right back. But remember, if you have any questions, you can SMS us on our SMS lines. Thank you so much. Welcome back to the other half of our conversation. And if you have any questions, please ask them on Tumaini TV Live, on Skygen, or on Nyaluk Foundation social media pages. Together with us now, we have another partner that has partnered with Nyaluk to bring this event today. So welcome.
Thank you so much, Cynthia. So my name is Brenda Zakini. I'm working with the Foundation for Preventative Health Kenya. As FPH Kenya, what we are doing mainly is trying to create accessibility of preventative health, that is eye care and dental care, within the rural areas. So we are trying to make people in the rural to get accessibility of the spectacles, and also for them to be treated if someone has any problem with eye or with teeth or anything to do with dental. And also we've partnered with Nyaluk Foundation. With Nyaluk Foundation, we're trying also to work with them to reach as many people as we can all over the country. Like right now we are in Nakuru, a place called Kihingo. We are trying to treat everyone, trying to make everyone comfortable, trying to make them access these health services at a free cost, because we understand that so many people cannot access these services due to lack of finances, due to transport, which some of the hospitals are far. Some of them don't even have, they don't even know about where they can go for this treatment, where they can access these treatment services. And that is why we are here today with Nyaluk Foundation. Thank you.
Thank you so much, Brenda, and welcome on board.
Thank you.
And so do you want to ask, can you talk about capacity building in regards to this legal and medical aids?
Yes, thank you, Cynthia, for the question. As we had earlier stated, as we stand right now, we are able to provide these free medical aid camps, but not really at that rate that would be convenient to every person to make us be able to reach every person. So in regards to that, in regards to being able to provide specialized treatment, we are also conducting capacity building. That is why you are seeing us partnering with the FPH here. We have partnered with Skygen. We are looking to be able to get more and more partners to be able to support our cause, for us to be able eventually to give comprehensive health care to those that are unable to afford it. We are also doing that in terms of legal aid. That is also a department under Nyaluk Foundation. As I had said earlier, we recognize the fact that legal services are not easily accessible to the people. Essentially, they are expensive. You see, advocates have an act they use to calculate fees. And essentially, once you have a cap for calculation of fees, then essentially it becomes not really affordable. So we are also working towards getting partners to be able to partner with us in the legal aid department, specifically sponsors and donors whom we can be using to sponsor more of these free legal and medical aids, for us to be able to make it accessible and affordable to the people. Eventually, like we had said, we have a very elaborate and effective strategic plan for 5 years, in which the main goal is to be able to make this as accessible as possible, as sustainable as possible to everyone. That would essentially mean, if I could just perhaps point out a specific case, it would mean somebody who is having maybe a terminal condition, health-wise, can be managed fully from, let's say, specifically this facility. And if by extension this person is having a legal issue that is challenging them, then they can be referred to the legal department, and the legal department can be able to take up the cases on a case-by-case basis and be able to follow up the cases to their logical conclusion. If it is a litigation, for instance, court cases, we can be able to cover all the costs, and we take it up and we are able to follow it up to its logical conclusion. So essentially, that is what we are looking at right now. We are really focusing on capacity building in line with our strategic plan. We are developing other policies to be able to shape, to be able to guide what we are doing on paper, and to be able to actualize it on the ground like today. Yes, I would say that is what we are trying to do.
Very informative. And Collins, towards trainings and maybe more partnerships, do you offer like maybe trainings? Do you take volunteers towards accessibility and stuff like that? So what would you say?
Okay, like my learned fellow said that we are looking forward to getting more partners to organizing these events, but also at the same time, our biggest partner is the government of Kenya, Ministry of Health, because without them, we could not have done this, because you see, like most of drugs and what have you we get from the government for free. Let's say the family planning, the vaccines, and other things they give us for free. So we are looking forward to getting more partners and partnering with them and making health more accessible. And at the same time, you know, health is not cheap, and even employing a health worker is so expensive because the salary and all of you. So we are most Nyaluk employees. Apparently we don't have employees, we have volunteers. So these are people who just come and give their services for free. They are giving back to the society. There are people who just like giving back or working with the organization for free. Like our able advocate, Diogratias, has been offering free services for 3-4 years now.
Yes.
Yeah, for 3-4 years, and he has also, apart from legal aid, he has also introduced a department for gender-based violence, where maybe if you disagree with the husband, the wife, or a child has been mutilated, so we have a very able legal team where these people can get justice for free, and Wakili normally follows them up until the justice is given to the victim. So as Nyaluk Foundation, majorly we focus more on the community, and we focus more on giving people the dignity, the life they deserve, pertaining all aspects of life, be it mental, be it medical legal, be it preventive, be it eye, be it laboratory, be it MCH. So I think going forward, we are looking for more services around, so that these people can get access to health as it should be. Yes, because health is a basic need, and it's a basic human right. Yes.
Just perhaps to just add on what CEO had said, as he has said, the right to health is a socio-economic right. We have a very progressive constitution, a constitution that guarantees social economic rights. Socio-economic rights, I would say health, we have housing, you see, we have access to education. These are socio-economic rights. So we have a legal framework that says that these are rights that are supposed to be provided for by the government. We are aware of the fact that the government is not able to fully fund this, and this is where we come in as a foundation. To be able to make this achievable, we have Vision 2030, which incorporates this. We have a period of time to be able to achieve this. So as a foundation, we try as much as possible to be able to provide these services, to be able to bridge that gap that is created by the lack of finances, which maybe the government is unable to afford as per right now. Also to add in terms of just capacity building, I remember we had talked about mental health.
Yeah.
Today we have already been able to see around 3 psychiatric patients. And we will all agree that you see, in terms of mental illness, it requires a specialized treatment. I think so. And you see, specialized treatment requires funding.
Yeah.
Capacity building is coming in that way. We are working towards getting more partners, towards getting more funds for us to be able to provide specialized treatment in regards to, let's say, mental health, in regards to all other conditions that we might be able to encounter during our medical aid. CEO had also talked about gender-based violence. We have a department incorporated under the legal department which also deals with GBV. We are saying that
This is also a menace that is affecting our society. Conversations are ongoing about it. We are saying we are strongly part of that conversation. We are saying we want to get involved. We want to offer solutions. We are saying we are approachable. You can always be able to come. You can always be able to approach us at any time, at any place. We have contacts. Under the legal department, I would also want to just share that we are in partnership with a firm in Nairobi, the firm of Omondi, Omeri and Mosaru Advocates. They have really tried to support us also. Unfortunately, the partners could not be able to be with us here today due to other commitments. But we also want to say thank you to them for supporting us. And that means in the department we have around 3 to 4 lawyers who are on call, who are always around to be able to offer these free legal aid services. So in terms of capacity building, again, I want to say we are committed to it. We have policies that we have laid down to be able to enable us to achieve this, to be able to provide the sustainable services that we intend to provide in accordance with our strategic plan. Yes.
And tukimalizia, Brenda, is there anything you've noticed that you'd like to maybe bring forward or maybe discuss with us even in future, or even in regards collaborations? Is it a worthy call? Can you advise other partners to join Nyaluk Foundation? Anything you have observed that you'd like to share with viewers or something like that?
Yeah, so simply I've observed a lot of things. One, I can say today our main aim was we expected most of the aged people, so I can say from the age of 45 to the age of 65. But having seen a lot of patients in eye care, I've seen also kids starting from the age of 3 going to up to 12 years. So also our main aim, apart from making our services more accessible in the community, is also to try and go to the schools and do school screening, because most kids in schools have problem with eye, they have problem with dental, but some of their parents don't have these finances to take them to the best hospitals or taking them to get the best services. So what you're going to do is also include school screening in our program. That is what we want to implement as from September. So that's what I can say I've seen, another challenge that I'm seeing today, and that is what you're going to implement as from September. About Nyaluk Foundation, I can say Nyaluk Foundation, they've given us a very big challenge. We didn't expect to see so many people as we've seen today, and I can say I'm calling as many partners as they can to work with Nyaluk Foundation, because I can declare to you that Nyaluk Foundation has given us a challenge that it has really shocked us. But what you can say, we want to work more with Nyaluk Foundation. Any other partner who wants to come and join Nyaluk Foundation, you are welcome. These are people who are going to help you make the preventative health more accessible in community, in schools, and all over the country.
Thank you, Brenda. And Collins, tukimalizia, any last comments?
Okay, what I would like to say is that this is one of our projects we've been doing this year. We have done 8, and normally we do them at local areas, maybe churches and social areas. But we wanted, I think we are targeting like 10, but we are past the limit where we wanted to get. So I think going forward, we want to partner with more organizations, and as Brenda has said, we are introducing a school-based care, where we'll be going to these schools, and also we want to partner with other hospitals, like local hospitals. Let's say maybe you have an hospital in Defu and they cannot give the eye services and dental services. We'll be putting Nyaluk logo and Nyaluk eye unit on those hospitals, so that it gives a good referral system, and it's also, it also tells people where they can get these services, because people are suffering and they don't know where to get the services. So we want to partner with schools, we want to partner with the higher institutions, higher level of higher learning institutions, colleges, and also we want to partner with schools and local hospitals, be it government and private hospitals. Yes.
And viewers, as we finish, I think it is important to have a stable health system for any Even if you are a farmer or a teacher, without good health care, you're not able to do your work properly. And even still on that, mental matters are still a problem. In such areas, we want to call on other people to join us, because most people don't believe that they have a mental problem, and the mental problem will lead to a health issue. So even at Nyaluk, we still talk about mental health. We encourage people to come. You'll always find someone in our clinics or on our social media pages that is able to listen to you, because most people just need a listening pattern. We also want to say thank you so much to our partners today, Skygen, FPH, Esilor, and Legal Aid Nakuru, Nyaluk Clinic. We also want to say thank you to the people who have come today. We are grateful. It's not every day that people show up to something like this wholeheartedly. And finally, we want to say thank you to Tumaini TV, as always. We are grateful for you, and thanks. Bye. We are yet with another patient today, and we would like to hear their commentary about today's event. So ma'am, ningependa kukuuliza majina yako, ulisikia aje kuhusu hospitali ya Mutukanio, na kama umetibiwa na kama umefurahia hiyo matibabu?
Kwa majina naitwa Mary Mudhoni Karanja, na nimefurahi leo, siku ya leo, kwa sababu sikuwa nikiona vizuri. Ni shinda yangu ni kuona mbali na sikuwa naona, na nilisikia watu tukitangaziwa kwa kanisa ati kuna matibabu ya bure hapa. Nikakuja na nimetibiwa, nimepata miwani, nimefurahia sana sana sana. Vile maisha iko juu, singeweza kujinunulia, na vile sasa nimesaidiwa, sasa nitaweza kufanya kazi yangu vizuri. Mungu awabariki, na wenye wamefikiria hayo mambo, Mungu awabariki sana na waongeze ziku na mali nyingi. Bwana awabariki.
We also have with us another important person on the day today, and I'll allow him to introduce himself and maybe tell us a little bit about what is happening today.
I am Ian Ngwata. I'm a medical student, a senior medical student at Egerton University. Today we have been handling patients. We've been handling a lot of patients, helping them on the dental area, the maternity area, the eye clinic, and we've been offering free of services to the masses from the youngest age. We've had patients from as young as 5 years old to patients as old as 85, and it's been amazing. Yes.
Is there anything particular you've observed today? Maybe something you'd want to comment about, challenges, maybe policy recommendations, anything towards that regard?
Well, I've been in the eye clinic. I've been in the eye clinic today since morning. We've experienced humongous numbers, and the entire process was fantastic. Everything went smoothly, okay, apart from the registration part, where you'd find 40 patients at once will be blocked, will be idle, waiting for roughly 30 more minutes before they are finally registered. But everything else has been fantastic. We've been giving them free treatment, free consultation, free spectacles and glasses, and for them to have a better vision for them to see properly in their classes, in their businesses, in their shambas. Yes.
Thank you so much, Ian. Tunashukuru sana kwa watu waliokuja leo kwa event yetu ya Skygen na Nyaluk. It was a free medical aid at Kihingo, and together with me tuko na mmoja ya elderly people wenye walikuja, na ningependa tu kusikia maoni yao kuhusu siku ya leo. So utaanza na kujitambulisha, alafu tuambie jinsi ulijua kuhusu hii siku, na kama umesaidika, na kama unaweza kuambia watu waje tena kwa kitu kama hii.
Haya, kwanza kabisa ninawashukuru. Majina yangu ni Monica Maina. Nilijulishwa kwamba kuna matibabu itakuwa ikiendelea hapa AIC Njoro, na nikashukuru sana kwa sababu nilikuwa na maumivu ya mwili. Nikaambiwa ni siku ya leo na nikajitayarisha mapema nikaja, na kwanza kabisa niwashukuru kwa sababu mna moyo kubwa. Mungu amewapa moyo kubwa kwa sababu huduma yenu ni mzuri, imenifurahisha. Nimetibiwa na nikapewa dawa. Yani service yenu imekuwa mzuri sana kwangu kwa sababu kwanza ukiona mtu amepewa roho nzuri na Mungu anatibu kulingana na vile Mungu amemsaidia. Moyo wenu ni nzuri, mmekuwa mnatutibu vizuri. Dawa zenyu pia mmetupea dawa. Kila mtu ameenda kama ameridhika kwa sababu ametibiwa, amepata dawa. Kama ni macho wameangalia vizuri, kama ni tumbo, kama wenye hawakuweza kabisa wametuambia tuna book, alafu baadaye tutaangaliwa. Kwa hivyo tunashukuru kwa sababu mnatufuatilia. Hata ingawaje kama mimi nilikuwa na shida ya tumbo na nimeambiwa nitafuatiliwa kwa sababu hawakuweza kuangalia tumbo yangu kwa leo. Kwa hivyo ninawashukuru kwa sababu pia hata kwa kufuatilia. Hiyo ni kipawa na ni Mungu kuwawezesha. Kwa hivyo nimeshukuru.
And we finally have a Skygen partner, and we would like to know what his thoughts are about this event.
I think it was a really great event, well put on, great turnout from the community. I spoke to several people and they also mentioned that they really liked the customer service that they received and they would be back. Yeah.
Thank you.